Hi, it's Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma, September 12th, 2020. Sorry I haven't been recording that much. That whole vacation thing then results in more work this week and more meetings after work. So for those of you who think I wasn't recording because I didn't want to talk about Trump, that has nothing to do with it. But I do always think it's very funny that everyone always goes to political stuff if there's a change. Now, the reality is when you're a doctor and you're gone, you have to then work more when you get back. But the thing people don't know about us, or a lot of us, is we have to then do the electronic medical record stuff at home at night to get caught up. So that is a primary responsibility which trumps being able to do videos, because we also had some emergency meetings at the hospital this week over some stuff in the evening. So anyway, let's get caught up. So we're averaging about 800 cases in Oklahoma. We had 51 day with 51 hospital admissions. Our hospital rate's going back up, unfortunately. So that's a bummer. Dr. Fauci has given some fairly significant warnings, which we're going to talk about as being particularly hilarious now more than ever because of the Trump stuff. So let's talk about the Trump stuff, because the Trump stuff, I think, is pretty definitive of the entire and complete failure of the federal system. So Trump, whether you like him or dislike him or have no emotional feelings about him from a scientific point of view when it comes to COVID, let's just talk about what happened briefly and then put it in reality. So he was interviewed by Bob Woodward for his book, and he said very clearly around February 6th that he understood the virus was could be spread through respiratory secretions and breathing, and it was troublesome, and that the virus was potentially very deadly. So that was a very significant thing, because he spent then most of February, and as I've talked about, did not do anything, but some of that I felt had to do with Fauci and other things, but he knew. So, and the problem is with it ultimately comes down to this. It's fine if he was trying to be calm for the country. That's what public health people do and everything. But behind the scenes, you have to actually do something. And the problem with him realizing and admitting that there was something going on and then not doing anything for a month, and then thankfully I thought in March he was going to close the country down, around March 6th when he had the big press conference, but then he did nothing afterwards. So again, devastatingly important incompetence, or I wouldn't say incompetence, just failure to do your job. But I think we got to now put it in what the smoking gun is, which is even more interesting, because for all of you who've been defending Fauci, you're idiots. I mean, I'm sorry. Who knew before Trump? Fauci. The whole reason I started this was in February, around the 6th or 7th, because Fauci went on TV and said everything Robert Redfield, who's also a total fail from the CDC, was saying, that there was a pandemic coming and we were going to be in trouble. Fauci then spent the next 3 weeks lying about it. Lying. So Fauci knew that it was coming. Fauci knew that it was spread by respiratory droplets. Redfield knew that. Secretary Hahn from the FDA knew that, or Commissioner Hahn. Secretary Azar of the Health and Human Services knew it, and the Assistant Secretary of Preparation, Dr. Robert Kadlec, all knew that, and not one of them did anything to prepare the country, which is what I've been saying for 6 months. So get off the Fauci chain, please. Please, because he's now, I'm glad he's saying now we're going to have a tough winter. I agree with that completely. But if you believe anything he says about vaccines or anything the federal government says about COVID, you're crazy, because they've clearly now, there's the documentation they've lied because of Trump. And they've known they've lied the whole time. So from lying about the masks, lying about it not getting here, lying about why we didn't have a test, lies, 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 and it's continued through current. And so if you think it's suddenly going to change, that they're suddenly going to be honest, you're foolish. I'm sorry. You got to get your head out of the sand. If you believe them, anything they say, except now I'm going to agree with Fauci on something. No, he's very concerned it's going to be a very bad season of COVID in the winter, which makes sense. I think he's accurate, and he's being accurate about that. But remember, forever he was like, oh, and forever in public health is the first several months when you can make a difference, and that's when he blew it. So let's then talk about, so is that enough, Kim, on that subject? Have I been very clear? Yes, no, Trump's admitted he lied. No, well, he hasn't admitted he lied, but he admitted he knew about it, which is essentially, yeah, so I lied about it for 2 months or 3 months or 4 months, and then I didn't do anything. And that's the thing that gets me. I'm okay with them. I'm not okay with them lying, but I'm okay with them trying to maintain calmness, because I talked about this way back in February, that from an ethical point of view, the public health service people believe that lying is okay to prevent fear. I disagree with that concept, but they're supposed to then be doing something to prepare the country and help people while they're trying to keep it calm. And what they ended up doing is they lied about the masks, the viral intensity, the spread, all of it, and then didn't do anything. Remember Robert KADLEC? You have to know that name, Robert KADLEC. He's the Assistant Secretary of Preparation. Didn't ever order any masks, KN95 masks, any of the mask stuff, any more PPE till March 6th or 7th. And then he only ordered 3 million masks, and then they ordered finally 15 million more in mid-March. Again, just totally disgusting and disturbing. So, and if you're a Republican or a Trump supporter and you're gonna bomb me like usual when I do this and criticize him, go ahead, it's okay. And for those of you who hate Trump and bomb me when I don't criticize him enough, hey, you don't have to bomb me for a day or two. So it's okay. I'm not political. I'm about the reality of what's going on. So let's talk about flu. And so flu infections, you have to understand something that's very important. All the statistics you hear and the numbers you hear are theoretical. What the FDA or CDC has done for the last 15, 20 years is they look at models. And so if there's actually 6,000 flu deaths, they end up multiplying it times 3 to give the impression there's a lot more. And they base that on a bunch of statistical stuff that's, I don't know any more about them, because I think they just lie all the time. And I'm going to talk about the flu vaccine, which is going to illustrate it. So when you hear, oh, there's 18,000 deaths, no, there were 6. And when we had that really bad flu season that killed, I think it was 60,000 or 70,000. No, it killed a lot of people, but documented wise, it was probably 20. So yes, it was more, but again, it's all statistical baloney at a certain point. So let's talk about flu vaccines. I'm going to have to talk about flu vaccines in subgroups because there's so many subgroup reports. I think it's easier to discuss it in subgroups. So there's a subgroup 6 months or less, 6 months plus to 18, 18 to 65, 65 and older, and then nursing home and non-nursing home, or healthy over 65 or debilitated over 65 in a nursing home. And then there's cancer patients across the ages. So what I'm going to talk about today is a holistic summary of immunology quickly for flu vaccines. And I'm going to focus on the over 65-year-old group because they're the ones that are going to get pushed for it more. So, but we're just going to do that group today. And then I'm going to, over the next few days, go through each group because the statistics vary across the groups in terms of the importance or non-importance of the flu vaccine. So when we think about flu and you get a vaccine, you're getting antigens or proteins on the outside of the flu virus that this theoretically will protect you, okay? And so the World Health Organization, CDC, come up with what they think is going to be the flus of significance next year, and then in the spring they pick what they're going to try to make the vaccine from. So the first thing to know is when you make a live attenuated vaccine, which is what they do for the most part, they're going to put that in a petri dish. It's going to replicate, and then they're going to take that out and turn it into use it as a vaccine. One thing that I've discovered, which I did not know, is sometimes the flu that they're going to use is going to mutate in the petri dish. So they may be thinking they're going to give you influenza A type 1A1. Well, it mutates and it turns into influenza A 2B6, which has nothing to do with the upcoming flu season. That has happened multiple times. There's nothing they can do about it. They don't stop giving the vaccine. They just give it anyway, and it's a bummer. And it's a particularly significant bummer with all vaccines when we start thinking about something called original antigenic sin or original antigenic seniority. Original sin is what we're born with if you're a Christian person. So original antigenic sin is when you get your first flu infection as a child, that sets up your immunity for the rest of your life against flu. So, or another way is the oldest infection, so seniority of infection, is the one that sets your immune system to fight infections within that category for forever. So what happens is we give more and more flu vaccines to people. There's the potential, like every year, click, 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 which I've been doing, unfortunately, which I'm looking at my wife going, yeah, well, I have no immunity now to anything. But you start burning through your immune system, and it can amount a good immune response then potentially to a new infection that's slightly variant from what you've been exposed to through the vaccines. So in other words, there's the potential that the flu vaccine actually backfires, and there's tons and tons of data showing that it actually does. So what I've done is, I read a summary on all of this, and then I went and pulled all the data from the summaries. And so a lot of the data that I'm going to talk about comes from something called the Cochrane Reviews, which I'll post the over 65-year-old one today, and have some pictures of excerpts of some signature things they say. So the summary, and again, this is not, you can just listen to this. You don't have to act on it. You don't have to follow my advice. This is not formal advice. I'm just presenting the science. It's a discussion with your own provider who probably doesn't know anything about this because they haven't taken the time and the couple dozen hours to read through this stuff and think about it. So just talk to them and see what they say, and they'll say get the flu vaccine. But anyway, so when you look at people over 65 and you look at the Cochrane Review of the data, it's really pretty disheartening because the data is based on, they say, observational and essentially meaningless studies showing benefit. And there's really marginal data showing any use for a flu vaccine at all in this group. But if you look at the best data, and that's what I want to present, just so you can have an idea, the best data within all these papers that they go through is it takes about 32 vaccines to prevent in one person in the 32 an influenza-like illness. Okay, so that doesn't mean you're real sick. You just have you got cough, cold, congestion with fever, basically. So if we then look at statistics on the flu, it takes probably about 1,000 of those, maybe 500, maybe 1,000 of those patients to result in the hospitalization. So that would mean, and we'll go with 32,000 injections to prevent a hospitalization. Well, then probably about 10% of those people die, so it's about 320,000. And now it may vary. It could be 160,000 vaccines to prevent a death. It could be 200,000. It could be 320,000. It could be 400,000. It's just, but it's somewhere, it takes about 100,000 to 300,000 vaccines to prevent a death. So the efficacy of the vaccine is actually fairly low. It's kind of a freaking waste of time in my book, especially since there's data that shows you can get reversals or you can get much sicker after you've gotten the vaccine if it's caused some immune responses that aren't protective but actually hide then the flu from you. So that's a really big issue to me with recommending flu vaccines. And so if we look then at historical data, which is very interesting, and we look at 2005 data, there's no data from before 2005 that I can find because the CDC has pulled all of it. It's all gone. That's the thing from this whole COVID stuff. No, they pulled data that they don't like. I never knew that. Who would have thought they would pull data that the government doesn't like? Well, I'm an idiot, so I didn't realize that the government does stuff like that. And the CDC does it, and the NIH does it, and the FDA does it, because if it doesn't follow the narrative, they pull the data. So it's really easy for you to find data from 2004, 5 forward on flu vaccines, except for efficacy, excluding 2008 and 9, because it totally backfired, increased the infection rate, so there you cannot find the data. They won't release it. And that crazy woman, Dr. Mikovits or whatever from Plandemic, when she talked about that, I didn't believe her. But then researching this other stuff, oh no, it increased the flu infection rate by several 100%, and they won't admit that or give any of the data. So anyway, so let's look at 2005. The efficacy of a flu vaccine from the CDC was 10% then, or 2004. In 2005, it went to 19%. In 2006, it went to 60%. And then it's pretty much hovered around that range ever since. And when I was looking just at this historical data and the efficacy, I thought, wow, what happened? I thought, did they change how they're given the flu? Or the vaccine, did they upgrade it? Is there some magical thing that happened? Or I also thought, did they change their statistical way of presenting it? And guess what it was? No, they didn't come up with a magical better flu vaccine. They started switching how they did the statistics. So the statistics in 2004 were like case control. You have people who get the vaccine and people who don't, and you follow them and see what happens. So the efficacy was 10%. So in 2005, they altered the statistical modeling into more of a theoretical thing, and it went to 19, and then from that point forward, they just kind of scaled that up, and it's 55 to 60%. It's utter nonsense. It's not true. It's not that effective. So if you hear anyone say that, it's a lie. And again, these people lie all the time, but it's a lie. So I'll be finishing up soon, but the flu efficacy of the vaccine, flu vaccine efficacy is not 60%, it's 10%. They've just changed the statistics. And so when Fauci's talking about, oh, we're looking for a 50% efficacy on COVID, that's using the same statistical method that they've been using for flu vaccines, which means it's utter nonsense to get a COVID vaccine, which is probably gonna get me banned from like half the planet, but you can't believe these people. So the summary is, if you're over 65, you and 32 of your friends or 31 of your friends needs to get vaccinated, and it's going to help one of you, and it's not going to help 31 of you. So just keep that in mind, and it could potentially backfire. And you just got to think statistics. Hey, do I want to take a risk? Have a vaccine could help me 3%, or not help me 97%. So that's just that age group. And that's probably the best age group in terms of getting a good response, excluding talking about cancer patients, which I'll get to. So that's a lot of information. When I'm not doing these talks, it's because I'm busy. It's not anything else. It takes a lot of time to sometimes prepare for these, and the flu ones I have to be very careful of because I don't want to have a mistaken statistical representation, and it's complicated stuff. And when you see the 97-page article on 65 and older and think every one of them's like this, you'll start to see why it takes a while to summarize the data. Anyway, take care, be safe. COVID's everywhere in Oklahoma.